Do you actually do that for every case in hospital?
For every case in hospital, we designate an ASA status.
Okay, so how do you explain the ASA status to students in a way that they actually remember it?
So, ASA status, it can be confusing, especially when you're learning anesthesia. How I tend to explain it is you should think of it as like fitness. So, ASA 1 is going to be very healthy, super fit, no medical conditions or comorbidities. So, like a super happy, healthy young puppy. ASA 2, you're going to have mild disease, but generally you don't require any medications for it, and it's really not going to affect the patient. ASA 3 is going to be when you start to have more significant disease and it's going to require medical management. So think about any of your King Charles Cavalier, the spaniels that have heart disease and they're on chemobendin. That's going to generally be your ASA 3. A 4 is they're a little sicker, actually a lot sicker, and but they're not moribund, meaning they're not close to death. And then when you get to the ASA 5, that's essentially when a patient is going to die without surgery in the next 24 hours. So, like a very sick septic abdomen or a GDB. And so, obviously, if you relate that to a fitness level, that's going to be someone that's probably not in shape. That's generally how I will scale it. And then the E is for emergency.
Do you actually do that for every case in hospital?
For every case in hospital, we designate an ASA status. It's helpful, one, to provide a context for everyone that's part of the team, whether you are a nurse or a technician or a doctor, to understand how critical the case may be. And then it also can help with our training. So when we're training either other veterinarians or nurses or technicians, it can help with just establishing training logs.